Good afternoon, everyone. Welcome to the Mile End Early Diagnostic Centre. I've got the pleasure of welcoming you here on behalf of all the EDC staff. It's great to see everyone, and thank you very much for taking the time to come here today. As many of you will be aware, due to COVID restrictions, we weren't able to have a formal opening, so we're really pleased today to have the opportunity to showcase what we've achieved together so far and what we hope to achieve. Just a little bit about the background to this. So we had the opportunity back in 2017, 2018 to bid into cancer transformation funding, and we knew several things. We knew that cancer outcomes in North East London were particularly poor, and we knew that we had a diagnostic capacity gap. So we had an opportunity to create something new with additional diagnostic capacity, but also to focus on outcomes. So the choice of our diagnostics and layering it in were quite strategic. So, for example, we know that lung cancer is the cancer that presents through A&E the most, and we had a CT scanner as part of the GRAIL project for lung cancer screening, and this will now become part of the NHS England targeted lung health check. We then knew that following on from that, colorectal cancer and the GI cancers, including liver cancer, have poor outcomes, the second most, and in combination they in fact are more in number than the lung cancers that come through. So we focused our attention through the cancer transformation funding on endoscopy and on ultrasound so that we could support early and earlier diagnosis for colorectal, upper GI and liver cancer in particular. We now are looking to, with the CDH funding, we've managed to get funding for an MRI, which will allow us to target the other cancers, so prostate cancer and breast cancer in particular, are two cancers where we know that there's been less treatments during the COVID pandemic, and together with a case finding study that we have, we need even more additional capacity. The principle here is very much like the high volume, low complexity. So the low procedural risk patients are cohorted here, but all the patients that come here have a risk of cancer. We set out to be a unique centre to align the national, local priorities as well as some of the aspects that we know. So, for example, we know that there's a cancer diagnostic workforce gap. So we've got an opportunity here, or we've had an opportunity here to create new roles, and you'll see that as we take you around on our tour. Uniquely, this capacity is system-wide. So again, this was a sort of NHS England criteria as we bid into this, that this needed consensus both clinically, strategically and operationally across the entire system. So it's been no mean feat to get us to this point, and there have been many, many people in this room who have brought us here on this journey. So you'll see that there's two halves. We have the two-roomed endoscopy unit, and had quite detailed demand and capacity modelling to know that we shouldn't need more than that in North East London to support our cancer pathways. And we have on the other side an imaging hub where we leveraged what was already there. So we have the CT scanner, and we now have access onto that, and we have breast screening. And we've brought in phlebotomy, so to allow us to have one-stop pathways. The vision here is to provide specialist, person-centred diagnostic care across the whole of North East London, and if you like, by having one centre that serves the whole of North East London, removing any unwanted variation that may exist for our cancer pathways. It's been a huge feat of collaboration, and it is focused on outcomes. Sharing our learning has been really important, and we've done that through part of the CDC programme that is occurring at the moment. It's been a 2 to 3 year journey to get this right, and there's been a lot of hard work, and we thank our ICS colleagues as well for getting the business cases through to support the additional activity. It's wonderful that we've got our patient representatives here who have been here since the start of our journey, and in fact they've very much been the drivers for this event today. The collaboration, as mentioned, is across the whole of North East London, so supports the whole of all the 8 hospitals, 3 provider trusts within North East London. And as an example of how it's helped, if you like, giving mutual aid within our own system, when we started, we had a backlog in endoscopy, for example, at the Royal London Hospital of 3,000, and this has now come down to 700. So we've managed to deliver on the DMO1 standard, which hadn't been achieved here since 2018. We're now working together with the Whipps Cross site to help support bringing that backlog down. Clearly, as additional capacity, this will bring in a significant number of additional procedures in the system, and with the MRI together, we could be looking at an additional 30,000 procedures that we're able to do here, if not more. And a key part of what we're trying to do is actually also remove duplication within the system. And it's given us an opportunity with some of the new roles that we've developed, for example, to take the opportunity to look at how we optimise the diagnostic tests that we do. So, for example, having an MRI physicist is really important for the safety and optimization of the image quality that we have on our machines. But across North East London, we only have 2.2 whole-time equivalents when we should have 0.5 across the 15 scanners that we have. So that would be 7.5 whole-time equivalents. So, as an example, we have developed a training program and bringing in more posts as the opportunity has come through with the CDC to ensure that we support that optimization and duplication reduction in the system that we have. The hard work has paid off, not only with the reduction in the backlog, but also the recognition both on the Tonight programme and on the BBC National News. And when the BBC actually came here, they did say they wanted to come back to do another piece on the innovation that we're doing here. So that's fantastic. So where are we now? We have, thanks to NHS England, got £3.64 million to get an MRI to complete the cancer diagnostic modalities that we've had here. We're going to the Barts charity to get a small amount of top-up funding to bring this to a 3T model to allow us to really focus on some of the oncological pathways here. We're also, as part of the CDC programme, linking in with our cardiology colleagues. Again, because we're outcome-based and the way that we are trying to deliver our pathways and improve, there's a lot of alignment in what we do. So we're very much looking forward to working with our cardiology colleagues to develop the model here. And that's really important because cancer outcomes, as we've said, are poor, and they were improving here. So we knew that with our improved access and delivery of the cancer constitutional standards, we were starting to see reduced emergency presentation, and we were starting to see a greater proportion of stage 1 and stage 2. And obviously our target and the long-term plan is the 75% of stage 1 and stage 2. So we were making that progress, but unfortunately with COVID, we know that we have gone backwards, as we have done nationally with missing cancer patients, that we are developing other campaigns to try to bring patients forward, and clearly we'll need more diagnostic capacity for that. The making every contact count is also very important to us. So patients who come through here, perhaps on a 2-week wait pathway, perhaps the positive predictive value is set at 3%. So 97% of patients won't have cancer, but we know that patients have a 1 in 2 lifetime risk of cancer, and we also know that 40% of cancers are preventable. So within the model that we try to do, when patients complete their diagnostics, we also have a sort of health and well-being making every contact count event that we'll be running through the educational centre here to support educating our patients to that end, to support the cancer prevention. The Rapid Diagnostic Centre Clinic is a really important NHS strategy as well, and I have 2 colleagues here who have joined us at Barts Health to support the RDC, the non-site specific RDC across offering capacity across all of North East London, and we have a clinic at BHIUT as well, and the Homerton are also about to open one, and we can work together as a network again to support faster and earlier diagnosis. I'm now going to hand over to Henry, who's going to give us an update on the Ics Perspective. Thank you.
Thank you very much, Angela. So my name's Henry Black. I'm the CCG accountable officer. So I'm the accountable officer for the local health commissioning. I'm also the senior responsible officer for the North East London Integrated Care System, which is a bit of a mouthful, but I'm essentially the kind of figurehead for the local health and care system. So it's fantastic to be here. It's actually the second time I've been to have a visit at the EDC, but it's fantastic. I first came to work in Tower Hamlets about 19 years ago, and the Bancroft unit looked very different then than it does now. But it's just a great example of how a kind of Victorian building can have a refurb and a reiteration and take on a new lease of life as in its latest incarnation. So you'll be glad to know I'm not going to talk for too long. I'm just going to say a few little thank yous. Firstly, I want to say thank you to our patient reps, and we're going to hear from Noel in a little while. Our patients have been absolutely at the forefront of this journey and have really been right at the front of the design process and have enabled the EDC to be a really good example of co-production and co-design. So thank you to them. I want to say thank you, a huge thank you and a personal kind of vote of gratitude for all the staff across the health and care system throughout the pandemic, but also for all the work that you've done to get us to where we are today. And massive thank you for keeping everybody safe and keeping the show on the road effectively. I also want to say a thank you to the kind of health partners. So it's great to see Shane and Matthew here from BHIUT and from Barts. And really, this is a really shared endeavour and a collaborative effort. And as Angela was saying, the EDC is a facility which is there for all of the patients of North East London, whether they had their initial diagnosis in BHIUT or Homerton or Barts. So this is a service for the whole of North East London. And finally, last but not very much not least, I want to say thank you to Angela for her incredible leadership throughout the whole process. Angela has been an absolute shining star. Without Angela, we would never be where we are today, and she is tireless in her efforts, not just in terms of her clinical lead for the Cancer Alliance, but also working throughout the pandemic, doing double shifts and all sorts of things, whilst also doing everything she needs to do, looking after her young family. So a massive thank you to Angela. So in a second, I'm going to hand over to Noel, who we'll hear from the patient perspective. Noel is the chair of the Patients and Carers Voice in Cancer. He's also very active in lots and lots of different areas across BHR, but also regionally across London and nationally. So without further ado, over to you, Noel.
Thank you, Henry. I've had a lot of personal experience of cancer myself. I've had 5 major cancer operations saving my life. I first had bowel cancer, and I should have gone to see my GP, but as many men do, they leave the symptoms, and eventually I did. I had 7 weeks of radiotherapy to shrink my tumour to make it operable. I then had bowel surgery to remove a stage 3 tumour, and then I had to have an ileostomy bag with it, which was then reversed 11 months later. After my bowel surgery, I had 8 cycles of chemotherapy. 2 years later, it spread to my liver and my lung. I had liver surgery at the specialist liver surgery unit at the Royal Guildford Hospital. 12 weeks later, I had a segment of my lung removed at Guy's Hospital. I then had 12 cycles of chemotherapy. 2 years later, my tumours spread to both of my lungs. I then had 12 cycles of chemotherapy. I also had Avastin. 6 months later, I then had specialist laser surgery at the Royal Brompton Hospital to remove tumours of one of my lungs. And then 6 weeks later, I had thoracic surgery on my second lung to remove the further tumours. And this was then followed by further cycles of chemotherapy and Avastin. My most recent experience of cancer was to have a basal cell carcinoma tumour removed from my right ear by Mohs surgery, quite a specialist technique, at Guy's Hospital in July. Even yesterday I was at Queen's Hospital to see my oncologist to report on my most recent scan, which, as I expected, was all clear, which was fine. Over the years, I've been asked to join a number of cancer groups, and I'm regarded as an expert by experience. Certainly not an experience of my choice. I've received wonderful life-saving treatment from the NHS, for which I am truly grateful. I wanted to get involved as a patient representative so that I can bring my perspective and experience as a cancer patient to help shape the future of cancer services in North East London, by providing a patient voice to ensure that the voice of patients and carers is heard and listened to by our Cancer Alliance. As I had numerous colonoscopies and endoscopies, I was asked to join with BHR clinical staff in preparing for a care Quality Commission inspection of their endoscopy services, and I worked with them towards that inspection, and on the day of the inspection I worked with the inspectors all day to get to a successful inspection. As a result of that, I was nominated by the Mile End to join the Mile End Early Diagnosis Centre advisory panel from the start of the project, as they wanted a patient who had a lot of experience of endoscopy services, ultrasound, CT and MRI scans. I'll move on to now our journey with our patient group at the start of the Mile End Early Diagnosis Centre. At the very first meeting, we were given a full pack of all the draft plans and all the specifications about the centre. At our next meeting, we met with the planners and architects so that we could make comments about the layout of the centre, all the spaces, and our views of the patient journey through the centre. I am pleased to say that our comments were taken on board and changes were made. What really impressed me after the initial meetings was that it was very refreshing to be given at the start of a building project all the plans, a big folder of colour plans that's never ever happened to me before, and we took them away to evaluate, and it made all of us as patient partners feel very much part of the team in the development of this new centre. And this enabled true co-production rather than joining late on when everything is in place. A major thing that really pleased me about the project was the consultant leading the project, Angela Wong, has attended almost every single patient group meeting we have had so that she could be there to hear our views and make us feel that the patient voice is important and would be listened to. I have been and still am involved in groups where rarely, if ever, the lead consultant would attend the patient group meetings. At the start of the project, the centre was in fact called the Mile End Alliance Diagnostic Hub. We as patients discussed this at length, and as the purpose of the centre was to diagnose cancer at an early stage, we suggested that the Alliance Diagnostic Hub should be renamed as the Early Diagnostic Centre. As well as patients, as we as patients felt this gave us a much clearer idea and message about its purpose. It was then agreed to change the name, which is a good example of we said and you listened. From an early stage, we were asked our views about travelling to the centre from our local areas, which was going to be a little bit further away. Our views as patients were we were happy to travel to a centre of excellence, a purpose-built centre, which we knew would be next to an acute hospital. With good transport links in London for all of us, the journey time from door to door was about 50 minutes. Over 1,000 patient surveys were given out. These endorsed our views. What also resonated with me from an early stage is that what doctors may think is important wasn't the most important thing from a patient's point of view. And we were always able and still are able to talk directly with the senior clinician leading the project to get our views heard, and she was prepared to listen and act upon it. After construction work started, we as a patient group carried out a site visit with the lead consultant, other Cancer Alliance staff, planners and the site manager to see how the work was progressing. And this was in fact during the pandemic. We were all kitted up and we walked through the mud and we could see the starting of the project. And we carried out further site visits as the project progressed, and eventually we carried out a tour of the centre as the finished product before patients started to come. As a patient group, we decided on the various colours of the paintwork for the decoration around the centre. We gave our views on the wording of signage, and our wordings were taken on board and things were changed on the signage. We were consulted about all the patient letters, and our comments were incorporated into the letters. I have made suggestions about adding murals that are at the haematology, chemotherapy and radiology at my local trust, and these have been so well received by the patients in those areas. Our patient advisory panel for the centre will continue into the future, and we hope to recruit new members from patients who are now using the centre. Patient feedback since the centre started taking patients in March has been outstanding. We have received 100% positive feedback from our patients, which shows we are getting something right. I am sure you'll look at the display boards which give statistics on our feedback and quotes from patients. I will now read out some quotes from our patients, which include some from our most recent September feedback, which are not on display here today. Everyone I've encountered today has been very welcoming and friendly. Beth greeted me with a big smile and bubbly personality. Great credit to your team. Thank you everyone for smiles and kind words today. Thank you to all of the staff involved in my procedure today. You are all doing an amazing job. I would like to congratulate all the staff at the unit, from Senka, great lady, to Maria, to the doctors, Star X and Ray. They have all been fantastic. The best NHS experience beating Harley Street. You guys are a credit to the service, brilliant. Keep up the good work and smiles. Very good experience, world-class care, very, very clean, very quick, no waiting about, probably the best hospital experience I have ever had, including private hospitals. The staff should be really pleased with the whole team. They are a credit to the NHS. From a personal point of view, I'm incredibly proud of what we've achieved here. We've got a wonderful centre, such a smooth journey from start to finish for our patients. I think there's lessons learnt here for future projects. And I think these can be used to sort of guide things for the future. Get patients involved right from the beginning of a project. See patients as part of your team. Make sure patients feel their opinions are valued and listened to. Make sure there's regular communication with meetings and emails. Learn from patients' experience of assessing services. I'm looking forward to working on more exciting and innovative projects to support cancer patients across North East London in the future. Thank you.